Hello everyone, I'm Dr. Nikhil Shellagi, Consultant Surgical Gastroenterology, HPB and Robotic Surgeon working at Manipal Hospital Whitefield, Bangalore. Today I'm going to discuss about stomach cancer. So what is stomach cancer? Stomach cancer is a cancer arising from the lining of the stomach. The most common variant is adenocarcinoma. Apart from adenocarcinoma, other cancers include lymphoma, gastrointestinal stromal tumors. What are the risk factors for stomach cancer? The risk factors include Helicobacter pylori infection of the stomach causing gastritis. Long-standing H. pylori infection is a risk factor. Apart from this includes alcohol consumption in excess and tobacco consumption in any form is a risk factor. People having strong family history of gastric cancer also having high risk to develop stomach cancers. Occupational exposures include people working in coal, rubber factories, and radiation exposure also has a high incidence of stomach cancer compared to the normal population. So coming to how do people present with gastric cancer or the stomach cancer? People having new onset dyspeptic symptoms, that is upper abdominal pain, indigestion, having lot of burps, and early satiety. Early satiety is after having small quantity of food, they feel they are full. People having a lot of nausea and vomiting, new onset, which is persisting. Or sometimes they can present with massive blood in the vomit. That can be because of bleeding from the tumor, or other presentation can be passage of black colored tarry stools. That is again because of a bleed from the tumor in the stomach. Loss of appetite is also a manifestation of any cancers, which is again seen in stomach cancers. Significant loss of weight, that is about 10% of the body weight in duration of 6 months is again a significant weight loss. So these are the symptoms. Coming to how do these people present with stomach cancer to the hospital? As mentioned, these are the symptoms, or they can present with severe anemia, which can be presented in form of generalized weakness, breathlessness on walking, or tiredness. So initial evaluation includes the blood test, followed by more specific test which is required to diagnose stomach cancer is upper GI endoscopy. The endoscopy is done to evaluate the food pipe, that is the esophagus and stomach. If the tumor or a big ulcer is seen, it is biopsy, and biopsy confirms the stomach cancer. Once the biopsy is confirmative of cancer, further testing needs to evaluate the extent of the disease, whether it is only confined to stomach or it has gone to the other parts of the body, which is most common is involvement is liver or into the lymph nodes. So it is evaluated by a CECT scan or a whole body PET scan. Once this is done, based on the stage of the disease, the patient undergoes treatment. So usually it is a multimodal approach, but the surgery remains the mainstay of treatment. People who have locally advanced cancers need neoadjuvant or perioperative chemotherapy plus minus immunotherapy based on the tumor biology, followed by surgery, and needs strict follow-up in the post-operative period. What are the preventive strategies or the things to take care to avoid stomach cancer? People who have H. pylori infection needs to completely eradicate by taking medications, avoid excess consumption of alcohol and smoking, avoid taking too much of processed food, increase intake of fruits, fiber and fresh vegetables, and people who have strong family history needs to get screened by endoscopy on regular basis. So any of the above symptoms as mentioned persisting for more than 2 to 3 weeks needs to be evaluated by a specialist. Thank you.